Hello, my name is Ryan Mann, and I'm a graduate student in the Master of Social Work program at the University of Washington, Tacoma. This is my capstone presentation titled Integrated and Accessible Mental Health Care. There is significant need for mental health services in our society, yet there are often not enough services available to support the high demand, leaving many individuals without proper access to care. There are barriers present in society that limit accessibility of mental health services to underserved populations, which works to perpetuate the impacts of mental illness in a variety of ways. I have nearly 5 years of experience working in the mental health field. I am a mental health technician in an adult inpatient psychiatric facility. I find fulfillment in helping those suffering from mental illness through difficult and often traumatic experiences. I have seen how the mental health system operates in our society, and I've observed how difficult it can be for individuals with limited resources to seek out services and receive treatment. It is my hope that this intervention can lead to greater accessibility for mental health services in underserved communities, and that there can be more individuals treated effectively for their mental health issues. There have been strides in recent years regarding the reduction of stigma surrounding mental health and an emphasis on receiving treatment for issues that may have been understood differently in previous decades. An increase in demand and a public sector that is ill equipped to handle this need has resulted in a national shortage of behavioral health providers and organizations that can effectively provide treatment. It is often those who come from underserved populations, including low income individuals and those from minority groups, who are most in need of support but are unable to gain access to mental health services. There are many barriers faced by underserved populations, including lack of funds needed for private insurance, which can allow for greater options available for mental health services. Low income individuals with limited access have a diminished ability to receive effective treatment, and this leads to poor outcomes for individuals who have their mental illnesses left untreated. There is also the factor of geographical location of service providers, which can be a barrier for individuals who do not have access to transportation. Factors that have been shown to have a association with poorer outcomes with access to healthcare include a disadvantaged social status, low socioeconomic status, gender, and membership in a racial or ethnic minority. The socially disadvantaged tend to experience broader barriers to obtaining health services. A research study on racial disparities in healthcare outcomes has shown that race and the inability to afford mental health services can cause Black individuals to develop worse mental health outcomes than their white counterparts. And the progression of illness in Black individuals often becomes more chronic and detrimental. I had the opportunity to interview several key stakeholders for this project, and I spoke with a social worker in the field of mental health, and her experiences support the need for greater access to care that I believe exists. She highlighted the many barriers that individuals may face, including homelessness, lack of transportation, and decompensation without proper medication services. The lack of resources that are available to those who need support and assistance in the community is an issue that deserves great attention. Critical theory, which works to address social problems by focusing on societal and cultural structures, is fundamental to my project and has helped guide my research on the topic. By working to address the inequity and injustice present in many areas of the healthcare system, I hope to be able to address the unique needs of individuals while also working to reform broken societal systems. By working to improve the current healthcare system in place on a broader level, I believe that the outcomes of individuals on a smaller scale will be improved and equity and access to services can be achieved. My need statement for this project is community agencies and healthcare providers need to be more inclusive and attentive to the factors that impact underserved populations in order to reduce the risk of harm and ensure proper recovery from mental illness. My mission statement is to provide equity and access to services that promote hope and healing from mental illness. The proposed intervention that I have identified is to create a comprehensive model for integrating physical and mental health care in order to increase accessibility to services. Integrated care models have been researched and proven to be productive frameworks for incorporating mental health care into physical healthcare systems through healthcare providers and community agencies. Treating mental health problems in primary care settings could have an important impact on destigmatizing mental illness and mental health care. If mental health concerns are treated as a natural part of the concerns of the healthcare system, including the central component of primary care, patients are more likely to understand and accept that mental health is an integral part of overall health. By creating clear guidelines for how to refer and accept individuals into the program, this integrated care model will work to increase accessibility by addressing the full needs of the individual in a comprehensive and organized way. Through the use of an interdisciplinary treatment team with an adherence to providing culturally competent care, along with the support from trusted relationships with community agencies, the proposed integrated care model will work to address the needs of underserved communities by providing targeted outreach and thorough case management for all individuals. Outcomes and effectiveness of the program will be evaluated through the use of client surveys to monitor the success of the intervention. The first objective of the intervention will be to reduce barriers to receiving healthcare services. This will be achieved when the criteria for receiving services meets the patient's needs and the needs of diverse populations are able to be met. The second objective of the program will be to have individuals gain increased knowledge of mental health resources. This will be achieved when individuals know where to go for appropriate care and they will know how to access appropriate healthcare coverage. Integrated care is a powerful intervention model that can increase accessibility to mental health services by allowing for a restructuring of the current healthcare systems in place, which tend to only account for physical health and not provide easy access to services centered on mental health needs. It is my hope that this proposed intervention can be a useful framework for community agencies and healthcare providers to work from when working to address ways to increase access to services to underserved communities that may face barriers to receive care for mental health issues. By addressing the factors that cause there to be inequity in healthcare access, we can work to ensure that individuals from all backgrounds are treated appropriately and effectively for the issues that impact them. Thank you for your time and attention to this presentation.